In this video, I'll be going through Tamsen Fadal's hormone therapy regimen. If you're new here, my name is Dr. Shadi Tabaei. I'm a naturopathic doctor and women's health and hormones expert, as well as a certified North American menopausal practitioner. And every week, Lord willing, I do make videos on different topics on women's health. So if you wanted to go ahead and subscribe and join this growing community, I would love to have you. I saw this video on Tamsen's profile. She's a menopause advocate as well as an author. She was sharing her hormone therapy regimen. So I thought it would be good for us to watch it and we can go through it, and I'll make some of my comments as well throughout the video. So let's go ahead and get into it.
This is my menopausal hormone therapy routine. This is progesterone. I take one tablet before I go to bed. It's 100 milligrams each, and this is every night.
She was using the 100 milligrams of progesterone, which is a very common prescription given to women who are getting very irregular periods or not getting their period at all. If you are still getting your period on a regular basis every month, then your doctor may recommend progesterone at 200 milligrams, just given half of the month. And then eventually what most women do transition to the 100 milligram once a night once their periods start to become irregular or they're not getting their periods at all. Now, why do we use progesterone in the first place? We use it for two main reasons. Number one is that progesterone helps with sleep. So this is why she's taking it at bedtime and not in the morning. If you take it in the morning, it can cause drowsiness. It causes a very relaxing effect which helps with sleep, so you want to take it at night. The second thing that we use progesterone for is to protect the uterine lining from estrogen. So usually when there's hormone therapy being used, there's also estrogen being used as well. And if we use estrogen by itself, what can happen is that the lining of the uterus can grow too thick. And so we don't want that from happening. So to prevent that from happening, we use progesterone to offset that lining growing too thick. Now, if you don't have a uterus, you don't need this added protection. So your doctor may not have you be on progesterone unless they feel like it will help you with your sleep. So 100 milligrams at bedtime, progesterone with estrogen, if you have a uterus, is a very good recommended dose.
This is the patch that I wear on my waist, and this is 0.075. This changes 2 times a week, Monday morning and Thursday night. So you can see this one's getting a little bit dirty because it's been on a few days, but it's got that glue right around it, which keeps it on even in the shower. So this is the estradiol, twice a week.
So she's using the estradiol, which is a bioidentical form of estrogen, which means that we have this form of estrogen naturally in our body. It's bioidentical. It's identical to the estrogen that we have in our body. I've done a separate video showing the difference between synthetic and bioidentical hormones, so I'll link that below so you can check that out. But this is the correct form of hormones that we want to be using for menopausal care. If you're on a synthetic form of hormone for menopausal care, it does increase cardiovascular risk, so this is not the right form for you unless you're using it for protection purposes. Now, she's using it in the form of a patch. It also comes in the form of a gel. The patch you just apply twice a week, like she said. The gel you apply daily. Now, this is up to your preference. Some people want to just have the patch and then leave it, forget about it, and just change it twice a week. And some people don't want something on them. They'd rather just apply a gel every single day and versus have it on them continually. Now, this is up to your preference, and your doctor will prescribe it based on your preference. She's on the 0.075 milligrams. Now, this is a little bit on the higher dosage with this patch. Usually it starts at 25 and then goes higher and higher depending on your response to the dose. So I usually start on the lower end and then go higher. Now, your dose may differ from hers. It really is the dose that you respond to. And throughout the course of being on hormone therapy, you might notice that you will change the dosage of your hormone therapy an average of like 3 to 5 times. So it's normal to see it change. It may not stay the same throughout the entire course of the time that you're on it. Now, what is estrogen used for? There's a lot of different benefits for estrogen therapy. Helps with night sweats, helps with hot flashes. It can help with mood in the perimenopausal community. It can help with skin dryness and vaginal dryness. It can help improve bone density. There's lots of different benefits. I have done a separate video on this in the past, which again, I'll link in the description box below, so feel free to check that out on your own time.
Testosterone, this is a new type that I'm testing out right now, and this tube can last for a while because it's only the size of a pencil eraser right in your hand, just a little bitty drop of it. You can put it on your inner thigh or your inner arm. And so I do this, I switch the sides that I do it on, and this is every day. Remember, this is my hormone therapy routine. Everybody's could be different. This is how I've refined it over and over with my doctor based on what I've needed through the course of time, and it has made a huge difference.
In terms of testosterone therapy, a lot of women ask me about it when they're on estrogen and progesterone. They also feel like they should be on testosterone. And there's only 2 reasons why I recommend testosterone: if there's hypoactive sexual dysfunction or if there's vaginal dryness. These are the 2 cases where I usually use testosterone. Now, it's easy to overdose on testosterone, so it's not something you want to use continually. Rather, what you want to do is you want to test your testosterone levels first. If they are low, then you use the testosterone for a few weeks, like 4 to 6 weeks. And then you test your testosterone through your bloodstream again. And then once it's reached at good enough levels, then you stop it. So it's not something you want to use continuously, because the side effect of testosterone is that it can increase the fat around the abdomen and around the organs, which increases the risk of fatty liver and cardiovascular disease. So it's not something you want to be on continually, and you definitely want to be on it at physiological doses, so smaller doses for shorter periods of time. Now, I like the fact that she said that this is her hormone therapy regimen and it may not look like yours. This is completely true. Your hormone therapy regimen may look different based on the fact that, do you have a uterus? Do you still get your periods? What sort of symptoms are you trying to mitigate? What dose do you respond to? So there's a lot of different factors that will change your hormone therapy regimen. So it's important to work with a doctor who is familiar with prescribing bioidentical hormones so that you get the right care. I hope this video has helped you. If it did, please press that like button so we can reach other women just like you. Let me know in the comments below if you do have any questions, and I will try my best to respond to them. All right, well, I will see you in the next video.